Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. This episode is sponsored by Boston Scientific and its educational website on erectile dysfunction, edcure.com. One study estimated that more than 50% of men over the age of 40 have some degree of erectile dysfunction, which can be frustrating and confusing. Go to edcure.com to find information on erectile dysfunction and treatment options, including long-term treatment options offered by Boston Scientific. Boston Scientific does not endorse any statements or opinions expressed during this episode. Hey guys, welcome back to Between the Sheets. I have another important episode for you today. We're going to get into some different therapy techniques and topics. I have a wonderful guest on today. This is Erin Pritchard. She is a therapist and she specializes in EMDR, which she's going to explain to us as a wonderful therapy opportunity for our patients. And then she also is giving services for culture recovery, Christian sex therapy, family systems. She's got a lot going on and she's going to give us lots of good tips today. So welcome, Erin. Thank you for being here.
Yeah, thank you for having me.
Yeah. Did I miss anything? Was there anything else about what you do that you want to fill in?
Oh, goodness. I think those are pretty much the main pieces.
Yeah. So one of the reasons that I really wanted to have you on here was to talk about EMDR. Because I know that it is, on the newer side of therapies and it has had some really great results. And one of the things that I know that it's been used for is PTSD and sexual trauma. So since this is a sex podcast, I thought it would be important to let people know that there is an option for helping. So can you kind of talk us through what is EMDR? Why is it helpful? And what are some of the maybe biggest diagnoses or issues that people would use it for?
Yes. EMDR, it's a big long mouthful, but it stands for eye movement, desensitization, and reprocessing therapy. It's actually been around since the 80s. So we're going on a couple of decades here, which is super awesome. But I think in the grand scheme of therapy world, that is a little bit newer.
Yeah.
It's a great treatment for trauma, for lots of the parts and pieces of trauma. So I usually describe PTSD symptoms to people as, it's depression symptoms and anxiety symptoms wrapped up in a bow of something happened to cause the combination of both together. EMDR is really great for both of those things as well, and lots of other stuff that people don't even think about. Performance enhancement, sleep, and some other pieces.
Okay. And what is it exactly? Is it a type of talking therapy? What is it?
That's a good question. It is not really a talk therapy.
Okay.
So, that is a pretty big piece that's different from talk therapy. You actually don't have to talk a whole lot about whatever it is that you're focusing on. So it's an 8-phase protocol that takes a look at the past, the present, and the future. And the whole point is to be have more neutral body responses to past triggers. So that's the short way of kind of explaining it.
Yeah. Okay. So almost to some degree like a cognitive behavioral type where you're kind of not necessarily getting used to it, but you're associating the trigger and then remapping how you respond to it?
Yeah. There's a little bit of talk therapy in some of the earlier phases. It's kind of prep work. We need to understand different trauma responses or kind of build up a distress tolerance or gain some coping skills before we get into later phases. But it ends up being pretty different because people's brains kind of do the work themselves.
Okay.
Not so much talking about it like you and I are doing right now.
Yeah.
The whole kind of theory behind it is that all of our brains are wired to want to adaptively integrate information. So all of our experiences, memories, sensations, everything that's happening, we want to integrate that in an adaptive way. And that process gets shut off during trauma or high periods of stress. So the brain is just allowed to do what it naturally would do anyways without that interruption.
Oh, I love that. that sounds fantastic. And like, I know I have had friends and family members with some pretty traumatic childhoods, whether it is, a family member murdered that they saw that, or they were sexually assaulted or abused, lots of variety of different traumas and how much that affects them throughout their life. So knowing that there's this other type of therapy besides just talking through it, which maybe hasn't worked for them in the past, it's such a nice thing that there's this other option.
Yes. Yeah, I think talk therapy is great. It has a time and a place, but also it just doesn't quite cut it. So EMDR really helps your brain and body it's just a deeper form of therapy.
Yeah. Oh, that's really beautiful. I love that. And what kind of traumas are you seeing specifically in your practice?
I work with kind of a range of stuff. So I work with one handful of folks is adults who have maybe emotional neglect in their childhood. Parents just weren't really there or have an emotional maturity level where they could attend to them growing up. So one's sometimes a little bit harder for people to recognize because it might look and feel on the surface like, oh, things were fine. But when we dig a little bit deeper, we see like, well, there was some really crucial emotional connections missing.
Okay.
I work with a lot of sexual trauma. I work with a lot of folks healing from purity culture and lots of ways that kind of takes shape too. So I work with a lot of folks with various pain disorders. So a lot of pelvic pain or pain after childbirth, things like that.
Oh, interesting. Which the pain with childbirth and pelvic pain definitely affects your sex life. So yeah, that is for sure. That's really interesting. I'm just fascinated by this. Is there a specific timeline that you try to move through these, or is it very individual?
Both is the answer to that, which is the best answer. On one hand, at some point getting to it is better than never. And also we can do kind of preventative work shortly after something happens so that symptoms don't turn into PTSD and they kind of just stay in that like more acute kind of typical trauma response and don't go on to linger.
Yeah, interesting. Since it's different than talk therapy, are there any types of, not warnings, I guess, but just anything different that you really have to get your patients ready for that is going to come out? I don't know if there's physical responses or anything different than normal therapy.
Yeah, there can be. I usually try to make sure people have the ability to distinguish, here's my thoughts, my body sensations, and my emotions. So kind of these three categories. We also need clients to be able to tell us when they are kind of heading outside of their window of tolerance. So if they're getting really overwhelmed or really agitated or really stuck or really dissociative, the ability to tell your EMDR therapist about that is really important. So if people don't have those skills already, we work to kind of increase the ability to do so. Okay. Those would be some of the initial ones.
Yeah. Very interesting. So you mentioned the purity culture. Talk to me about that. What does that mean to you? And what are your clients kind of, I guess, what's their issue that they're coming to that you're like, oh, this is coming out of the purity culture?
Yeah. My favorite one to work with from an EMDR perspective is when women have vaginismus and like pelvic pain, right? So penetration is often impossible or super painful, difficult, various degrees of that. EMDR is super awesome for helping them move through like any negative experiences that they heard about, setting up this idea that sex is supposed to be painful or should be, or that first time, or some of these really innocuous comments that people didn't really realize would stick in a certain way. And yeah, so I mean, kind of going back a little bit, purity culture would be a lot of the shame and fear messaging used to drive home a Christian sexual ethic of abstinence and sex before marriage. So
yeah,
it's a little tricky because lots of religious groups have purity as like a core sexual ethic, and that's okay by itself. People can choose that. The problem is more of how was it taught to people, and those shame-based messaging really kind of sticks, especially with women. So we use EMDR a lot to kind of untangle some of those messages. And I just love helping women kind of embrace their sexuality and realize that it's not bad or wrong. You're okay. You're good.
Yeah.
You're fine. That's kind of how I like to combine them.
I love that. And I think, it's so important too with the purity culture to allow women and men to allow pleasure, and that sex isn't just for procreation. It is not just, because you're married, you must check this box X amount of times a week or something like that. It truly is it's okay to feel pleasure and to want to have sex with your partner. I think that's so important.
Yeah. Yeah, I agree.
Yeah. And when you're working with people that have some of these, kind of pure upbringings with this shame associated with it, what are some of the issues that they're having in their relationships?
A lot of times folks will have just differences in desire, or one person seems to want it all the time, one person doesn't. A lot of times the women have these obligation sex messages, like I should have sex, and kind of as a byproduct of that, have these messages around what does it mean about them as a wife, as a woman, as a person, if you don't. So we can use EMDR to untangle some of those messages as well.
Okay.
I guess I should kind of describe a little bit more about like what EMDR could do with the like thoughts.
Yeah.
You know how there's a difference between what you might know in your head about yourself. You're like, you can think like I'm a good person. But maybe your gut belief is kind of different. If you really pause and think about it, you're like, am I a good person? Like there's kind of a discrepancy there. EMDR is good for closing that gap. So we can kind of make those gut level beliefs that are maybe more negative starting out, we make them more true and more adaptive. Kind of tying that in with some of like the sex pieces, right? So having the belief, maybe I'm not a good wife or I'm not a good spouse if I don't always give in to whatever it is my partner wants. We can kind of correct that in someone's brain. Yeah.
Yeah. Yeah. And one that pops into my mind is, you've been, especially with the purity culture, is you get one partner for life, you wait till you're married. And so, maybe you've had multiple partners because that's what you enjoy. And, you're at a phase of life where you've had multiple sexual partners. And in your head, you're a good person. You're not a whore. There's nothing wrong with you. But there's this gut feeling of I'm wrong. I've done something wrong because I was told I'm only ever supposed to have sex with one person for my entire life.
Yeah. Yeah. So, we'd kind of take a look at people's values too. If that's part of your value system and if there's something that's not congruent there, it's not going to feel good. But if you've changed your values, you can kind of work on that.
Yeah. Yeah. That's really interesting. So with your practice, are you focused on individuals or do you also do couples?
I see individuals for EMDR and I do see couples as well, but I don't yet do EMDR with couples.
Okay. That makes sense. And yeah, because I can see like as you're talking through the EMDR that it's very personal and needing to work through your own stuff, that having somebody else there might kind of actually interfere with the process.
It could. And there is some cool work out there that some folks are doing to incorporate the partner into the EMDR experience. I just haven't done that yet. It's on my radar. It's something I always kind of want to do and not quite done that yet, but people can.
Yeah. Okay. Talk to me more about the Christian sex therapy and how you work through with those clients. What are some of the issues other than, maybe the fully purity-based stuff that you're having them come and talk to you that things just aren't right for them?
Yeah, gosh. A lot of times for women, they will have experiences of low desire or kind of like I was talking about earlier, like these really negative views of themselves if their lived experience isn't matching up with whatever they were kind of taught about how they should be as a woman or a wife or a married person. Work with a lot of people who've got lots of pelvic pain, kind of think also.
Are you finding that some of the pelvic pain people are because of past traumas and that's where they're storing their pain and their trauma? Or is it more injury related and things like that?
It's largely from the religious trauma, which people are surprised by that is quote unquote enough of a trauma to count. But our body responds to trauma in all sorts of ways. Yeah, a lot of my folks that I see who have pelvic pain, the trauma is the religious piece more often than not. Sometimes it's other stuff too, but more often than not, it's primarily growing up with a super shameful religious sense.
Yeah. And it's such a shame that happens because I think for a lot of people, religion is such a wonderful outlet and a supportive environment. And it's just a shame that other side of it exists as well, and really makes it really difficult for some people to believe, to participate in this faith that they had, or to just have normal, healthy relationships. Yeah. One of the purity issues and religious cultural issues that I see at work as a urologist is issues with masturbation. So I'll have women who just have never masturbated, have never used a vibrator, nothing like that, because it is not allowed. You weren't supposed to do it. You're never supposed to touch yourself. And I see the more of the shameful side of it on the women. I think it's a little bit more accepted for men to masturbate. But even that, I had a client today who his wife isn't very interested in sex anymore. So they have sex once every couple of months. And so he will masturbate here and there to, relieve himself. And he feels so much guilt about that. And I talked to him today and I was like, from a health standpoint, regardless of your religion, and I'll let you deal with that your way, but from a health standpoint, having regular ejaculation is so healthy for you. It's healthy for your mental status, your physical status. It's healthy for your prostate. There's so many things that benefit both for men and women. I know this right now, this guy is a man, but orgasms are really important to our overall health. And so how do you help people kind of like break past that barrier?
Yeah, that's a good question. I mean, part of it is kind of figuring out what is their value system, right? And how concrete is that, or how flexible are they around renegotiating some of that, especially if it was for, some of these health benefits, right? Is there any wiggle room or not? And kind of being respectful of that in either direction. I'm thinking of one couple that I worked with in the past who they specifically were Catholic, but they wanted to get permission from their priest to engage in some of the sensate focus exercises that I was going to do. So, if you want to go chat with your priest, you want to go talk about this with someone, cool, go do that. Go feel like you get the permission that you need if that's where you need it from. I think, as providers, we can respect that for people. And sometimes it's just a matter of having conversations and kind of planting seeds to get people to question things in a different way for themselves.
Yeah, I think that a lot. And, it's interesting because with dealing with men with prostate cancer, whether they have their prostate removed or they go through hormone therapy, whatever, there's a period of time where they're not getting regular erections just because of the treatment that we put them through. And one of the things that we offer is different medications that can help enhance your ability to get an erection. And we call it penis therapy. It's penis therapy. I don't even know another way to describe it. It's like your rehab program for your penis. And it's fantastic. But we ask them to get erections once or twice a week, whether they use it for masturbation or sex or anything like that, because the penis is one of those body parts that if you don't use it, you lose it. And so you can lose girth, you can lose length, you can, if you're not consistently using it. And some of these guys are on treatment for a couple of years and we don't want them to not use it that whole time.
Sure.
And so I have had to talk through some guys like, you need to think of this as part of your exercise program. If you're against using it because you don't believe that that's allowed for you or something, that's separate. If that's your belief, I will respect that. But I still want you to use these medicines and to get this erection as an exercise. And I think some of them, like you were saying, like that mind shift, when I talk to them about that and how this is really, truly exercise for your penis. And if you want to be able to use your penis again 2-3 years from now, I need you to be working it out. And, think of it just like going to the gym and doing your bicep curls. Your penis needs exercise. So I've kind of tried to work on that side of things and that angle with patients, but it's a difficult one to overcome.
It is. Yeah. There's so much. And if you ask someone to do that for their arms, right? If you're like, go home and do some bicep curls, no one would complain. No one would give two shits. They'd be like, yeah, sure. How many? How often? They would jump into that. But there is such a stigma when it comes to sexual arts.
Mm-hmm. Yeah, absolutely. Do you have any patients that come to you who are LGBTQ, who were raised in the purity culture, religious culture, that are really struggling?
Sometimes, yeah.
Yeah.
Yeah, I mean, those folks are especially disenfranchised by purity culture. Really, everyone is, just in very different ways.
Yeah.
But yes, 100%.
Yeah. I mean, I just think of even today going into churches and listening to the messages that are promoted and some religions and churches that have not kind of tried to enhance what they're teaching and to be a little bit more open-minded. I can't imagine how uncomfortable that would be.
Sure. Yeah. You can take away some really painful, really shame-filled messages about yourself, your being, your sexuality, all of those things from those experiences. And that's a shame.
Yeah, for sure. Can EMDR help with that part of it, with working through the religious shame with your sexuality?
Yes. Mm-hmm. Yeah. So those would be some negative beliefs that we could kind of target with EMDR around. I'm wrong, I'm bad, I'm an abomination, I've heard. So yeah, we can definitely work on some of those with EMDR.
Yeah. Very interesting. And then how about, do you deal with any couples or individuals who are kind of on the other end of the spectrum that are into, kind of more of the polyamory and the exploration of kinks and things within their relationships and how that works?
A little bit. That's not my primary area of focus, but I have worked with couples a little bit in that area.
Yeah, I find that fascinating too. I think, it's interesting. The more couples that I meet that participate in the lifestyle in different ways, I'm just so fascinated by their level of trust and communication within that partnership that I think is really lacking in a lot of relationships.
I would agree with that. There are really foundational pieces that are missing, especially for folks kind of coming from like an evangelical or a purity culture sort of background. I mean, I grew up in that background. We did not learn about consent is often like a big one that's missing. So like these really crucial pieces for the emotional safety that there needs to be for sex to be good.
Mm-hmm.
Yes, a lot of other communities do it a lot better than the faith-filled ones.
Yeah, it's very interesting. And I think, because I grew up Catholic and I've tried different religions throughout my life. And so, it's interesting as I have grown and learned myself, and what I believe in myself has changed over the years. And that has affected my sexual practices and my sexuality, and how I associate with other people and their sexuality as well.
Yeah, I would say that's the same for me. And I hope to help clients with that too, to some degree, because I think a lot of times if you're holding yourself to a set of standards or ideas, it just kind of comes out weird in some of your other relationships where you might not even realize the things that you're kind of thinking about other people. And so it's very limiting for all parties.
Definitely. And I think, we were growing up in a Catholic church. I was told you don't have sex before you're married. There wasn't any talk of what to do that wedding night, though, when all of a sudden you're supposed to flip the switch and be a sex goddess and know what you're doing and be ready for it. And, I think that's a downside of that culture as well, where we don't prepare people for that, men or women, that the first time might hurt, but it might not. I mean, that's fine. I think like you said earlier, a lot of people are taught that it's going to hurt. You're going to bleed, you're going to, like all these things, which is not necessarily true. And no one teaches you how to please your partner and how to enjoy this intimate relationship. And I think that's really sad.
I agree with that. And specifically, no one teaches women that sex is for you too. Like you're not there as an object, you're an active participant.
Yes.
It is just as much for you to have a great time as it is for your partner. You're not meant for your body to be used in some way. You're there to also participate and experience so much pleasure.
Yeah, absolutely. And I think, back to the masturbation side of things, I'm a huge proponent of self-care, self-love, and practicing your own pleasure, because you can't teach your partner how to please you if you don't know what works for you. And so that's something that I'm just really... I love that for people. I take the time, touch yourself in different ways, use different materials, different pressures, speeds, all the things, and figure out what really works for you so that when you are with your partner, you can take things to that next level and really enjoy intimacy. But that takes a level of comfort and communication that isn't always taught or isn't even a thought.
Yeah, no, I mean, I think people usually have the idea of, well, it's natural, so it should be easy. And lots of stuff is natural that's really difficult. Like you gotta learn how to eat. No one is born knowing how to eat. That's a whole big process to learn how to use your mouth and all of your teeth and all that as you grow into them. I mean, just this idea of natural equals easy, really problematic. There's a huge learning curve, and it's okay to have that.
Yeah, absolutely. And, even for people who are willing to explore and have sex with different partners and things like that, each partner is different. And you're different with each partner and each phase of life. And so this constant changing ebb and flow of your hormones and your desires and what works for you and doesn't work for you. And if you can't talk about that with your partner, that's really frustrating.
Yes. Yeah. So for some of the women that I work with, I can use EMDR to kind of help get through some of that discomfort, having conversations or using certain words or whatever kind of mental block that they have in the way of being able to communicate about their body or their preferences to a partner. We can use EMDR for that, which is cool. Yeah, but I definitely tell my clients it's your job to know your body. And it's your job also to communicate that to your partner. It's not their job to figure you out. You're not a puzzle.
Right. Absolutely. Absolutely. And we're not mind readers.
Right.
Yeah. And I think that's so important to make sure that people understand that. Like, you could be the most sexually experienced person, but if you don't push my buttons the way I need my buttons pushed, it doesn't matter what kind of experience you have.
Right.
And I try and remind people of that too, that are saving themselves for marriage, who want that one partner type of relationship, and that you can have an amazing sex life just with that one person and working with them and yourself and finding what works for you guys and continuing to adapt that.
Yeah. Yeah. And to tie that in with the purity culture piece, just because you did that doesn't mean that you're going to have a magical sexual experience or no problems in your relationship or no problems getting pregnant if that's what you went down the road. Like, people will tie it into almost like a vending machine sort of, well, because I did this, I should get these sort of results. And so working through that takes a lot of grief. There's a lot of grief.
I bet. Yeah, I can imagine. Wow, I never even thought of that. So people save themselves for marriage thinking that, okay, I'm doing everything right. So then when I am ready to have kids, when I am ready to have sex, everything is just going to be smooth as butter and there aren't going to be issues because I obeyed.
Yep. Yes. So I work with a lot of folks who believe that and then who are very much let down by actual experiences of actual sex.
Oh, that breaks my heart.
Right? I know. And they're not broken. They just need to learn that there's different types of desires and the quality of your relationship impacts stuff. And but it can turn into like a real faith crisis for a lot of people too, which also is really sad.
Yeah. Yeah, absolutely. It's, it's that negotiation side of things, right? If God, let me do this and then I'll go to church every Sunday. And for these people, it's almost the opposite. I've done all of the things that you asked and now I'm not getting what I want.
Yeah. Yeah.
That's sad. That it does. It breaks my heart thinking about that. That really, I had not considered that.
Yeah.
Yeah. Wow. So talk to me more about, what do men come and see you for in relationship to sex? Because we've hit on a lot on the women.
Yeah. So a lot of times it's kind of funny to me when I notice that when men reach out on behalf of working with their partner, like, so me working with both of them, their issue is we're not having as much sex as I want. My wife doesn't want as much sex. And then we have to talk a lot about the quality of their relationship. And a lot of times what I find is there is like a male entitlement that is coming through that we gotta, if they're not willing to figure that out and learn to view their partner as a person, they're not going to make a lot of progress. So a lot of times the men who reach out are ultimately wanting more sex, and I have to get them on board with like, look, that's cool.
Yeah.
And also you have to be a great partner first. That'll kind of come naturally after some of these relational pieces are in play, but you gotta kind of go sideways to that as the goal. And also that's not a goal, you know? So, yeah, it's kind of funny. Sometimes when men reach out, that's ultimately what they're wanting to work on.
Yeah.
And then we have a lot of other conversations around, mental load and do they know their partner's body and all sorts of pieces.
Yeah, absolutely. Lessen the burden so they actually want to have sex and have the capacity to have sex.
Yeah. I also work with a lot of men who have a partner who has their own sexual trauma. A lot of men who they themselves have their own sexual trauma and are trying to navigate, just what do I do with this? How do I heal from this? How do I not have this kind of
Yeah.
show up in my current relationship? Or if my spouse has a lot of trauma, how can I still pursue her and love her without triggering her? So I work with a lot of folks who are trying to, in some capacity, make sense of, how do we have this be good when it
Yeah.
previously has been so bad and so harmful?
Yeah. When you're having men reach out because their partner was traumatized and they're trying to learn how to do things better, is it men of women that you're already treating, or could it be completely random?
It's more so random because I
Okay.
wouldn't typically be able to see like two individuals
Got
already.
it.
So if I was seeing a wife and their husband reached out, I could talk with them for maybe a couple of sessions with them
Yeah.
together, but I wouldn't be able to work directly with him because it'd
Got
be a
it.
conflict of interest. Yeah.
And are the men who are coming to you because I basically want to have sex more often and my wife isn't on the same page, is that coming from the religious culture as well, or just societal norms?
I think both. And I think when people see me and see on our website, like Christian sex therapy, they think that I'm going to be maybe on an unhealthy side of things and that they're going to
Yeah.
drag their wife into therapy and I'm going to tell her, you need to sleep with him more. That is a lot of times what people expect of me.
Mm.
And I am breaking hearts all the time with that. In therapy with me, I'm very much like, no. That's not it.
Yeah.
So,
Let's work
um,
on you, actually.
right. Yes. So, I've had that a handful of times, and it's always a delight to navigate with.
Yeah. Yeah, I'm sure they really appreciate that.
Sometimes no,
Yeah.
and that's okay. If they're not ready.
Yep. Yeah, that's a tough spot to be in because you definitely want to nurture and help them to see the other side. But I mean, just like in anything, some people are never going to see past their own point of view.
Sure. Mm-hmm.
Yeah. Yeah. Interesting. All
Yeah.
right. Let's see. What else? In regards to, the sexual health and working through things, is there anything else that sticks out to you that people really need help and advice with?
The mental load piece is really crucial also because, gosh, when men aren't pitching in at home and sharing in that mental load, when there's not an actual equal or equitable distribution of some of that mental load, people do not realize that that takes a toll on their sex life, on their relationships, that is going to tank women's desire, especially.
Yeah.
And yeah, when people are viewing their partner as a kid, that's not going to promote
No.
desire. If you feel like you're parenting your partner, that's not going to be it for your brain.
Right.
So,
Right.
yeah, I think the mental load piece is one that I often work with couples on, especially kind of first for some of those relational safety pieces.
Yeah, absolutely. Do you see that mental load with men who are kind of in like high stress jobs where they can't quite shut off work when they come home and that there's kind of a barrier for them?
Yes. And also, I think a lot of it's also just kind of culturally or some of the spiritual pieces of like, what do we typically define as woman's work
Mm,
in the
mm-hmm.
homes? Yeah, just a lot of different ways that is kind of showing up for people.
Yeah, interesting, interesting. This is such a great talk because I think that, there's so much that we miss by just kind of going through life, that there are people who are really hurting and that it's these deep-seated beliefs that
Mhm.
really need to be brought to the surface. And I think, do you find that some people don't even really realize what it is that's causing them to have such shame?
I think so. Yeah.
Yeah.
A lot of people, it's funny. Sometimes the people who come to me specifically know I have purity culture trauma.
Mm,
That's what they want to work on. And other times, I'm the one who's kind of like, hey, have you ever heard of this? I think that this kind of fits for you. What do you think? And kind of planting that seed. So, yeah, sometimes people just really it's so part of our culture and people's experiences that it's hard to even label it as a problem, I think, sometimes.
yeah, so interesting. And it just hits home for me because of having been raised in a religion and in a very religious household. And just to be very clear, I'm not saying anything against being religious. If that's what you want to do, that is great for you. I fully support that. I think just like anything that you can be involved in, there's good and bad. And so I think just kind of pointing out some of the issues with the culture, I think is bringing certain things to light, allowing people to feel okay talking about them and allowing them to explore that a little bit more and see, is that where this issue is coming from? And then, like you had said earlier, does that align with my values? Does that align with my beliefs? And can we adapt something in between there so that I can enjoy this part of my life?
Yeah. I help a lot of people kind of figure out, is what you were taught what you want to believe? And if not, is it maybe like an issue of the message was okay, but how it was taught was a problem? Like, there's just a lot of nuance to some of these pieces, I think.
Yeah. Oh, it's so fascinating. Such an amazing discussion. Thank you, Erin, for being on here today. This is great. Yeah, tough topics, but I think we held them respectfully and worked our way through.
Definitely.
Yeah. Excellent. For anybody that wants to get in touch with Erin and work with her or learn more about what she does, we'll have some links for you in the show notes. Thank you so much for being here with us today. Appreciate you all listening as always, and have some fun between those sheets. We'll see you next time. Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics Between the Sheets.